Epiretinal membrane disease. Hey folks, it's Dr. Sam, and I received a question today about this condition, and this lady wants to know if there are other options besides surgery. So let me lay it out for you. First of all, what this condition is a tissue starts to overgrow on the surface of the macula area. Another term for this would be macular pucker or cellophane maculopathy. So basically the macula is getting wrinkled, and it can create a distortion in the center part of your seeing where you get detail, where you see detail. Now lots of times there's very little symptoms, if no symptoms, and then in the later stages, again, you start to lose some of your center acuity. So what are some of the causes of this condition, epiretinal membrane disorder? Well, number one, I would say something called a posterior vitreal detachment, where the vitreous, which is the jelly-like part of the eye, starts to come away from the retina, especially in the macula area, and this creates a wrinkling effect in the macula. I would say the second causative factor is diabetic retinopathy or diabetes. So you want to make sure to have your insulin levels checked and that you don't have diabetes. Now, in terms of conventional treatment, what's recommended is something called a vitrectomy. And this is where they make some little slits in the sclera of the eye. This is the white part of the eye, the outer covering of the eye. And they substitute some vitreal gel with some saline solution, and then they go in with some forceps to spread out the macula so it's less wrinkled. Now, in terms of the surgery, about 1 in 100 people can develop retinal detachment after the surgery, and 1 in 2,000 people can develop some serious eye infections after the surgery. Also, there's a trend that when you have a vitrectomy, you have a higher incidence of developing cataracts. Now, in my world, I see that all eye problems have a root in terms of systemic and metabolic imbalances in the body. So some things that I would recommend for you would be, number one, reduce your stress level. Number two, get better sleep. Number three, I would get at least 20 to 30 minutes of aerobic exercise every day. You know, there was a study that came out in the Journal of Neuroscience which says that if you get aerobic exercise, it can actually reduce your retinal degeneration. I would also take stock in what pharmaceutical drugs you're taking, because those side effects can affect the integrity of the retina and the macula. I also would get some UVA, UVB sunglasses, wraparound sunglasses that block the UV light. And I would also get some blue blocking lenses if you're going to be using any digital devices. My exercises work really well, and of course, I would supplement with lutein and zeaxanthin just to protect your macula from degenerating even worse. So there are some things that you can do to neutralize this situation. Do your research. Also, if you have any more questions, feel free to contact me.